طبعا about the anatomy of the spleen, the weight of the spleen about 150 gram, dimension about 12 by 7 by 4 cm. Location, usually it is intraperitoneal organ located in the left upper quadrant, usually protected by ribs from the 8th ribs to 11 ribs. Relationships to the spleen, left kidney posteriorly, diaphragm superiorly, fundus of the stomach and splenic flexure of the colon anteriorly, and tail of pancreas to the right side. Relationship is important for dissection and during splenectomy. It is very important. Blood supply to the spleen is by splenic artery, which is a branch of the celiac trunk, and short gastric arteries. Venous drainage to the splenic vein. Splenic vein start from the spleen and at the posterior aspect of the pancreas communicate with the superior mesenteric vein to form portal vein. Lymphatic drainage to the pancreatico-lineal lymph node. Okay, and the visceral surface of the spleen related posteriorly, located in the posterior extremity to the gastric surface, superior and anterior border. There is suspensory ligament to the spleen called splenorenal ligament اللي هو lenorenal اسمها الثاني, gastrosplenic or gastrorenal ligament, ومثل ما قلنا lymphatic drainage of the spleen to the pancreatico-lineal lymph node. Regarding the physical examination, مثل ما أخذتوا اللي ماخذ عملي بالجراحة, usually normally it is cannot palpable unless it is enlarged twice or thrice of its size. During splenomegaly, palpable below the left subcostal margin, at least مثل ما قلنا double the size of normal, اللي هو about weight of 500 milligram or more, length above 15 cm or more. Splenic notch can be palpated in massive splenomegaly. Massive splenomegaly occur in malaria, in severe thalassemia major. إن شاء الله من نداومون أطفال يشوفون. The splenic notch is easily to be noted in thalassemic patients. Regarding the physiology of the spleen, there is 4 functions of the spleen: pitting, filtration, storage, okay, and immune function. And the 5th one is obsolete during the life, but in intrauterine life, the 5th function is hemopoiesis. Regarding filtration, splenic blood flow of 250 to 350 ml per minute. Removal of event or damage RBC, white BC, and platelet. Cellular debris about 20 ml per day. Regarding the storage, platelets are stored, 1/3 of the body platelets are stored at the spleen, okay? And the spleen contains 25 ml of RBC mice at any time, okay? So it is storage blood element. Diagnostic evaluation of the spleen. Indication of this investigation usually to assess size of the spleen and determine the degree of splenomegaly before elective splenectomy. And the second, investigation of the left upper quadrant pain. Third indication of investigation, delineation of the tumor or cyst of the spleen. The fourth indication, characterization of the abscess. And the last one is guidance for percutaneous procedure. These investigations include ultrasound, CT scan, MRI, and isotope scan, technetium-99 radioscintigraphy. And the last one is angiography. What is hypersplenism? Hypersplenism exaggerates destruction or sequestration of circulating blood element, RBC, white BC platelet, producing monocytopenia or pancytopenia. Normally responding bone marrow with hyper-functioning bone marrow should not be confused with the splenomegaly that goes with is only physical enlargement of the spleen. Okay? عادة hypersplenism either primary hypersplenism or secondary. Primary hypersplenism usually diagnosed by exclusion made after all possible causes of the secondary hypersplenism are ruled out. Maybe early manifestation of the lymphoma or leukemia. When there is no cause, should suspect. When there is primary hypersplenism, should suspect malignancy like lymphoma or leukemia. عادة is need cured by splenectomy. While secondary hypersplenism usually produced by portal hypertension, the commonest cause of secondary hypersplenism is portal hypertension. Splenic vein thrombosis, inflammatory disease like malaria, immune infectious mononucleosis العفو, TB, sarcoidosis, collagen vascular disease like SLE, and neoplastic disease like lymphoma and leukemia. What are the absolute indication for splenectomy؟ مهمة جدا. تعرف يمتى نسوي splenectomy. The first one is primary splenic tumor. Second one is splenic abscess. Echinococcus cyst, hydatid cyst. مثل ما قلنا عادة هو rare يصير بالسبلين الهايداتid cyst. قلنا the most common site is liver. About 70 to 75% is liver. And the second most common site is lung. And the spleen can be when it is multiple hydatid. The spleen is involved in hydatid disease. Hereditary spherocytosis. This is indication for splenectomy. Massive splenic trauma. هسه نجي عليها. Not all the splenic trauma need splenectomy. Only massive splenic trauma when the vital sign or when the vital sign or the patient is unstable, okay, needs splenectomy. Bleeding esophageal varices with splenic vein thrombosis. Spontaneous splenic rupture that occur when there is massive splenomegaly in case of infectious mononucleosis or malaria, which is common in tropical countries. Relative indication of splenectomy. Primary splenic disorder like primary hypersplenism مثل ما قلنا. Splenic cyst, disorder of the splenic blood flow like portal hypertension with severe hypersplenism. Infiltrative disorder like myeloid metaplasia, sarcoidosis, Gauger disease, metabolic disease, hematopoietic disorder like hereditary eleptocytosis, thalassemia major, and sickle cell anemia. But not all the thalassemia or sickle cell need splenectomy. Only when the patient or child of thalassemia needs splenectomy, it is not to cure the disease of blood disorder, but usually decrease the frequency of the blood demand, blood transfusion, congenital erythropoietic porphyria. Okay. Other indication is immune disorder, like acquired immune hemolytic anemia or immune thrombocytopenia berbera. Syndrome like Felty syndrome, SLE, neoplastic disease, especially in staging laparotomy for Hodgkin and non-Hodgkin lymphoma, and chronic lymphocytic leukemia and chronic myeloid leukemia. These are relative indication for splenectomy. موضوع المهم الآخر هو rupture of the spleen. Rupture of the spleen either traumatic or spontaneous rupture. Traumatic rupture of the spleen usually result from penetrating gunshot wound or stab wound or blunt RTA. Where the most common solid organ injury in the car accident or blunt abdominal trauma, especially in children, is splenic. And sometimes it is traumatized by iatrogenic during surgery, by excessive traction or misplacement of retractor during surgery, during major surgery like gastrectomy or surgery of the pancreas, when it is retracted the spleen from the field of the surgery, sometimes there is iatrogenic injury to the spleen by assistant, and this trauma to the spleen may need splenectomy. And sometimes the rupture is delayed, especially after trauma, and the patient is at the start is hemodynamically stable, okay? But this hematoma due to trauma, sometimes there is delayed rupture, okay, after 7 to 10 days. Traumatic spleen managed as ATLS, who advanced trauma life support, okay, by primary survey, secondary survey. ان شاء الله تاخذوها يعني كموضوع منفصل هو التروما abdominal trauma. Primary survey ABCD, okay, airway, breathing, circulation, positions of the patient, and then secondary survey or examination of the patient as a whole, thorough clinical examination, detailed abdominal examination, okay, then investigate the patient, okay. When it is a stable patient, need fast ultrasound is the primary investigation for splenic trauma that detect hemobritonium and give sight of blood source like from the spleen, from the liver, from the pelvis, from the pericardium, okay. Sometimes the patient, when it is stable hemodynamically, need detail of solid organ injury by CT scan. CT scan is important for give detailed information about the solid organ injury, and also give grading of the solid organ injury, whether liver or spleen. and the grading أعطيك فكرة عنه. Grading of the splenic trauma from 1 to 5 when there is laceration أقل من 1 cm, 2 when the laceration is 1 to 3 cm in depth, and grade 3 when there is more than 3 cm laceration, and grade 4 when more than 75% of spleen injured, and grade 5 is shattered, there is vascular and the hilum is injured. Okay, عادة need immediate surgery. Okay, spontaneous rupture usually from the infectious mononucleosis or leukemia, malaria. Okay, and some patient is spleen spontaneously ruptured. عادة يجي emergency المريض. Splenectomy, either open or laparoscopic splenectomy. Open splenectomy through access to the abdomen through a midline incision or left subcostal incision, and when it is elective splenectomy should follow rule of splenectomy by ligation of the artery اللي هو عادة يكون at the superior aspect of the pancreas. We isolate artery and ligate تعقدة بوحدة, and then dissection of the hilum to ligate the splenic vein, and then we do splenectomy by dissection of the suspensory ligaments to isolate the spleen from the other ligament, from the splenorenal, splenogastric ligament, and when it is elective. When it is splenectomy of the trauma, we concentrate on hemostasis because the patient has bleeding. So we packing of the spleen, and then we clamp the hilum of the spleen rapidly to restore the hemostatic function to the patient. Okay, laparoscopic splenectomy, it is procedure should know the study for the position and the placement of the trocar and the intracorporeal hemostatic instrument like ligature or clamping or clips, this to ligate the artery and splenic vein. اوكي، هاي مجرد ما تاخذون فكره عن how do splenectomy. It is either by open or laparoscopic splenectomy. تمام شباب. الموضوع الاخر هو complication after splenectomy. تتعرض له هوايه كطبيب. After splenectomy there is complication. Post operative atelectasis is common after splenectomy, and post-operative pleural effusion بحكم قربها للdiaphragm. Okay, sometimes it is reactive pleural effusion. Pneumonia, post-operative pneumonia. So the respiratory complication after splenectomy is common. Hematoma formation, bleeding is common due to a slip clips or slip ligature خصوصا بالتروما. So post-operative hemorrhage after trauma is common. Subphrenic abscess, left subphrenic abscess. Infection. Pancreatitis اللي هو عادة traumatized or trauma. Pancreatitis due to trauma during splenectomy. Pseudocyst formation, also the same cause during difficult splenectomy, may cause pseudocyst of the pancreas. Pancreatic fistula, when there is iatrogenic injury to the nearby spleen, may lead to the pancreatic or gastric fistula. Delayed gastric wall perforation. وقلنا delayed because the greater curvature of the stomach usually supplied by short gastric vessels. When ligate the splenic artery and the ligate short gastric vessels may lead to the ischemia to the greater curvature. And the ischemia may cause delayed gastric wall perforation. And sometime after splenectomy may cause acute gastric dilatation in the same cause due to ischemia to the gastric wall, lead to the acute gastric dilatation. So every patient with the splenectomy should give or should put the NG tube. Thrombocytosis, increased platelet. DVT after splenectomy is common. Thromboembolism, okay, and pulmonary embolism. This is a complication after splenectomy. Overwhelming post-splenectomy sepsis, which is a grave complication after splenectomy. Incidence about 0.5% during patient life. 80% occur within 2 years post-splenectomy. Occur as non-specific mild flu-like symptoms, may progress rapidly to hyperpyrexia and shock and death after splenectomy. الصير عادة greatest risk in the young patient children in the first 2 to 4 years of life. الصير عادة قريبة للسبلينكتومي within 2 years post splenectomy، لكنه ممكن يصير الريسك مال السبسيس يصير لايف تايمز after splenectomy. اوكي يصير باليانج patient عادة when the indication of splenectomy is other than trauma, like especially when the indication is a blood disease. اوكي ممكن يصير post splenectomy sepsis. More serious disease as indication for splenectomy. Hematological indication versus trauma. Disease of the reticuloendothelial system usually is commonly associated with the post-splenectomy sepsis. With concomitant chemoradiation. When the patient take malignancy and take chemoradiation and splenectomy, then so that it is associated with the post-splenectomy sepsis more. Etiology of post-splenectomy sepsis, it is usually or commonly by streptococcal pneumonia, about 50 to 90%. Haemophilus influenza type B cause post-splenectomy sepsis. What is the treatment of post-splenectomy sepsis? The prevention is common by immunoprophylaxis with polyvalent pneumococcal, meningococcal, and H influenza type B vaccine at least 7 to 14 days before elective splenectomy. واضح؟ إذا splenectomy is elective قبل 7 إلى 10 إلى أسبوعين العفو نعطي dose of vaccine اللي هو نيموفاكس والمنينجوكوكال and H influenza type B vaccine, or as soon as possible after surgery. When the surgery of the splenectomy is emergency due to trauma, can give vaccine after surgery, but as soon as possible after surgery. Booster vaccination with the pneumococcal vaccine every 5 to 6 years. نعطي booster dose of vaccine. Antibiotic prophylaxis, daily single dose of penicillin or amoxicillin for the first 2 years after splenectomy. Daily for 2 years, especially in children below 12 years old. Antibiotic النت واضح شو يقطع النت. سمعوني شباب؟
دكتور
نعم
واضح.
دكتور واضح.
دكتور يعني هو بيضعف.
المحاضرة هي مختصرة. Antibiotic prophylaxis مثل ما قلنا daily single dose of penicillin or amoxicillin for the first 2 years after splenectomy, especially in children below 12 years old. Antibiotic prophylaxis for high risk patient up to 18 years old. يعني مثلا leukemia, مثلا blood disease, okay, lymphoma, we give antibiotic prophylaxis. لكنه إذا adult without risk factor, no need for long time antibiotic prophylaxis, just in children. And seek immediate consult if the flu-like symptom begin after splenectomy. This is advice for the patient with splenectomy and have any flu-like symptoms. We should give consultation for physician. خلصت محاضرة السبلين.